And just as patients can have nausea or vomiting as a side effect of their treatment, certainly there are many financial side effects. So my predecessor and friend who's in the audience, Dr. Derek Ragavan, had the innovative idea with the teams here to bring the same expertise that we normally do to treatment planning around tumor board. If someone has a cancer, we bring experts around the table, they all kind of give their 2 cents, and we come up with a treatment plan. In the same way, different expertise around an individual's financial challenge. Is that transportation? Is that lodging? Is that copay for medications? Or some other burden? So 2 really innovative programs, and really excited for you to hear about them.
Yeah.
But we'll hear about them in just a moment. Let me hand it over to you for some thoughts.
So actually, I know exactly what you're talking about, because like you, both my parents died from cancer, and then my sister had a stem cell transplant not very many years ago. And I know when people hear that word cancer, that's the last thing you hear. You hear nothing else, because you're so in shock from, like, where do I go? What doctors do I take? How am I going to pay for this? And so having someone walk you through that process every step of the way to not only provide emotional support, but really to help you walk through, your medicines, what time your appointments are. Make sure that you have, like you're saying, someone to drive you there, because honestly, you're so shaken. Or, how many times have I gone with members of my family? I mean, certainly when my son was diagnosed with cancer, I was the one who went with him to his chemotherapy appointments. And so all of that, and the diet, just all of it, it's overwhelming. And I'm sure everybody here, like you're saying, everybody here in this room understands that. And because I'm sure you know of someone who at this very moment has been diagnosed with cancer, or you've known someone who has maybe died of cancer, or has maybe hopefully become a survivor of cancer. So I understand everything you're saying. I'm so grateful actually to, when we started the Cancer Moonshot in the Obama-Biden administration, I'm so thankful that we had the opportunity that we could take it forward and do what we're doing today, because yes, Joe and I were very lucky. I mean, we had access to really good care, and we could afford the care, and we had private insurance. But so many people do not. And it just depletes their bank accounts, because who is going to say, if they're saying to you, you can try this medicine, but it's $1,000 a week or a month, and it's for your mom, who's going to say, Mom, I'm sorry, but we can't buy that for you? Who's going to say that? So it's so important that we find a way to help families afford their cancer treatments and everything else that is involved. I mean, the parking at the hospitals. I mean, things are really expensive. The meals that you have to eat because you're there, you're not like dropping in just to see your mom for an hour. You're there the whole day. So I'm so thankful for what you're doing here. And I have to say, I'm so thankful to Joe that, after our son died, I mean, we had to find purpose, because you, and you probably know this yourself, and that's why we're here. That's the only way you can sort of take something that's so horrible and so devastating and turn it into something good. And that's what you've done. So I thank you for this. And I thank the press for getting out the word, because otherwise the people here in this state, they need to know that there is help available, that they are not alone. So I want to thank all of you for being here. Thank you.
Wonderful. Director Refmo, so first, we're delighted that you're our new NCI Cancer Center Director, that you're visiting here early on in your tenure. Perhaps we'll become one of your favorite cancer centers. Any thoughts you'd like to share?
Yeah, thank you. I'm really proud that this is my first NCI designated cancer center visit, and that it's
It'll definitely be a favorite.
Yeah. And on your 50th anniversary year, and in a state that I used to call home, and both of my children call home today. So
Oh.
I wanted to say, though, I've also been a medical oncologist, taking care of patients with complex cancers for 20-some years, and can see firsthand how navigation can help get the right patient to the right place and the right treatment most effectively, and make a real difference. So to me, it's a huge honor to have the chance to see this now move into something that's available for every patient, because every patient really deserves that kind of opportunity.
Yeah.
I think the other piece, the tumor board that you all have done, we've all known about for a long time. It's really a hallmark in the field for managing the very complicated parts of paying for healthcare. We can point to some direct effects of the Moonshot, both for navigation. I'll give one example, which is the accelerating colorectal cancer screening and follow-up initiative that has made a real difference, but also funding to support understanding that financial burden and how we can best manage it. A lot of it we've learned here as well. So thank you very much. I'm really happy to be here.
Yeah.
Wonderful,
Thank you.
wonderful. Hey, Mayor Lyles, our Charlotte Mayor of the great Queen City, have thoughts for us today?
I do have a thought. I have many thoughts about this because, First Lady, I would like to say, Dr. Biden, Atrium Health and Advocate Health, they bring a new dimension to this city that's going to make a real difference. But I also have to recognize Sandra Levine, who has stood by this community with her philanthropy, with her family's philanthropy, and we so much appreciate this. And what I want to say is that, I'm a cancer survivor, a breast cancer survivor. And during this time, I can see the changes in the way that you speak about cancer, the way that we act as we're going to work with patients. And I'm just so grateful that our residents they have the possibility to come to some place where they do have the support system, the services that are necessary to, just lift themselves up and hopefully survive. So I'm grateful for all of the kind of research that you do, all the efforts that you put into it. And I just want to say thank you to each of you on this team to being here in our community, working for our people. It makes all the difference in the world. Thank you.
Wonderful. And the Vice Chair of our wonderful Mecklenburg County, Mr. Jarrell, please.
Well, thank you so much. Dr. Biden, thank you for being here. I also want to say welcome and thank you to Advocate Health and Ms. Levine and just everyone. Dr. Mesa referenced earlier that, cancer has robbed so many families. We've all been touched by it. My family is no exception. When I was 9 years old, my father lost that battle to cancer, and our family did. But as I stand here today, I'm just so heartened because I think about, I know we lost that battle, but I feel like we're going to win the war. And I just want to thank you for your advocacy and what you're doing and the resources that each and every one of you are providing. And I'm so proud of our community for coming together and bringing all the stakeholders together. So thank you so much.
Thank you.
Wonderful. So let's pivot to these two programs. In many ways, they have important connections. But first, Chris Blackley does a superlative job leading our wonderful cancer navigation program. Why don't you share with them a little bit about the great program?
Yeah, sure. I don't know if I can describe navigation any better than the First Lady did. She did pretty well. I'll let you know when we have another opening.
Hopefully I won't need a job soon.
Hopefully, I agree. But again, on a serious note, when someone is diagnosed with cancer, it's terrifying. And it's not only terrifying for the patient, but it's terrifying for their family. And like you said, as soon as the patient hears those words, everything else just blacks out.
Yep.
And they don't remember, what they were told. And again, it's such a shock, like you said.
Yes.
But then when people go home and the shock starts to wear off, they have questions that they didn't get answered when they saw the doctor. What is this going to mean for me and my family? Will I be able to work? Can I afford this? do I have someone who can watch my kids while I go for treatment? So those are things that the navigators really work towards providing for our patients. Navigation got its start actually because it was working to overcome barriers that patients had as they were going through their treatment. Like we've talked about, financial, food insecurity, housing insecurity, other things, that are very difficult to deal with, especially with a cancer diagnosis. And then we've also been able to do some exciting research here, and so be able to show some improved patient outcomes. Patients who have a navigator have fewer visits to the emergency room. They're less dependent on that. They have fewer readmissions after they've been in the hospital. And of course, they miss fewer appointments.
Yes.
All of those, and more, are something that helps save in healthcare costs as well, and resources that are, valuable right now.
Sure.
She's looking at me when she said
Yes. We've been very fortunate here. At our cancer center, we have 65 navigators right now.
Wow,
And
good for you.
Yes, it's very unusual. And last year, we navigated over 10,000 new patients, new cancer patients. It's been so robust because our leadership here understands the value. But this is a benefit that we provide our patients free of charge. So as you know, that is difficult to sustain over a long period of time.
That's right.
Especially as we grow, and then we have to send out Dr. Mesa and Dr. Woods to go try and round up some money to try and help support our program that we think is so important. So that's why I'm so grateful for everything that you've done, and the Cancer Moonshot, because as long as I've been in this position, this is what we have been working for, is to get it recognized for what it can do for all of our patients, for all.
Yep.
And to be able to provide that support that those patients need. So I just can't thank you enough. And really, it's going to add to the sustainability of navigation for the long term. So thank you so much.
That's good to hear.
And it's such a critical program because we both bring together disease-specific navigation, but then we also have, as part of our Office for Cancer Health Equity, as part of our NCI Comprehensive Cancer Center, population navigators that have different complementary expertise that really are trying to overcome challenges with language, with culture, or other aspects of health equity. Now, clearly something that is frequently found during the process of navigation is financial toxicity.
Yep.
So Dr. Greg Knight, one of our wonderful colleagues, he's a hematologist, but he, along with Dr. Derek Ragavan and Caitlin Hensel, who wasn't able to be here today, many others involved in really putting together this innovative program. Greg, why don't you share some of those details?
Sure. So as we had mentioned, financial toxicity. So this is something that we're now learning more about and from a research perspective realize is incredibly crucial. So we always think about the physical toxicities, the nausea, the vomiting, the loss of hair, but the financial toxicity is devastating for patients.
That's right.
And we now know that it also decreases quality of life, but it also increases chance of death if you're experiencing this. So here at this institution, we decided to try to tackle this problem, and we created this thing called the Financial Toxicity Tumor Board. As Dr. Mesa mentioned, we tried to go like a disease-focused tumor board, where you bring in all these experts into a room and you go, let's figure out a solution to this. However, when you're starting to talk about things like financial toxicity, that is a very complex problem. We need to go for the entire cancer center and use all of the resource we have. So not just medical people, but we need billing, we need administrative, we need nurse navigation, we need social work, we need all of these people in the same room to bring their expertise to the problem. So just a quick example, just to kind of show you how this works. So we had a case recently, a young person, they have a GI cancer, and they lost their job. And this was because they have cancer, they could, the treatments and not being, and so, it's devastating, they've lost their income. Well, they've also lost their insurance because their insurance was from their employer. And so this person is just in dire straits, and their physician presents them at the tumor board and says they don't know how they're going to pay for their cancer. They don't know how they're going to be able to get here. Even if they could pay for cancer, how they're going to get here. and they don't know if they're going to be able to have food on the table. And so what's amazing is when you're in that meeting, then all of these people with all this expertise can jump in and say, oh no, we have all these things we can offer. So we immediately got grants from both internal and from foundation for food, transportation, and cost of living. We had the financial people immediately look at the case and be able to say, okay, we can get them COBRA, get the insurance back. Now, for those that know about COBRA, they know that getting it is not the problem sometimes. Paying for it is the problem sometimes. And we were immediately able to do that within the confines of the meeting. And then we were able to connect them with financial navigation. And in financial navigation, they were able to make a plan and an off-ramp. So, you know, eventually, maybe going to an ACA plan, maybe doing these things where everything is covered. The advantage of this is when this person is cured from their cancer, they're not going to have crippling debt. They're going to be able to live their lives and live a normal life post-cancer.
That's right.
The last part of that case that I found so exciting was that for our center was that we realized that we missed this, right? Like as a center, we should have picked this up. We should be screening more. We should be doing these things. And this is when you have all these people in the room, you start to figure out these system problems. And what we've realized is we need to do a better job, and that's what we started to do. And so the hope is now thousands of patients, because we discussed this one case at the tumor board, will be screened and maybe never get into that situation. Now, I would be remiss if I didn't mention one other part of the tumor board, and this is this thing we call the patient assistance program. Now, this is designed to be the kind of the front door because we know that there are common things that are going to be problems for patients, like co-pays and medication costs, right? Almost everyone that is going to have these issues. So we want to take that away, right? We want, when you're getting treated for cancer, we don't want you to be thinking about these things. We want to assist if you need the assistance. So in the past 2 years, we have had 6,000 patients served by our copay assistance for a value to the patient of over $6 million. For our free drug program, 10,000 patients have gotten free drug for a value of over $200 million. And we think these programs work together so well because now we can take care of the common things, the copays, the drug costs, and then if it's complex or there's other issues we need to bring the Cancer Center to bear, then that goes to our tumor board. And we're able to fulfill our mission, which is to be able to treat everyone regardless of circumstance. We are so excited to have you here. We are really excited to, you know, this is work we've been really proud of. I'm really proud of our entire team with this. And I think that I'm hopeful. I am hopeful to Dr. Rathmel that, you know, this will be this will be adopted by other cancer centers, and we can really start to finally make a dent in this issue with financial toxicity.
Wonderful. Well, thank you.
You're doing a great job.
So we know that, you know, we're making great progress in cancer, but we know that that progress really has yet not been for all. One of the reasons I'm proud of working here is, again, it's truly a strong for all mission. And part of that is creativity, but part of that is also innovation of how do we really accomplish that. So very excited to introduce our Dean of the Wake Forest University School of Medicine, Dr. Ebony Bower, who, again, through her leadership and the model of the School of Medicine as the academic core for our system, helps bring innovation to health equity. Dean Bower.
Thank you so much. And as somebody who spent my entire career focused on health and health equity, I'm so honored to be here with Dr. Biden and Dr. Rathmel as we focus on cancer health equity. These models have talked about how, and Dr. Biden, you really talked about how everybody needs to have access to this care. And at our school, health equity is fundamental to our mission, and we're thrilled to train the next generation of cancer doctors, the next generation of cancer researchers, to support the research that will find the cures, and to help support these innovative models around health equity. We just want to thank you for your support of this mission. What you're doing in cancer affects millions of people who will, or in the future, or have cancer now, but it's also a model for the rest of the nation as well. The models that are happening coming out of the cancer field are also, we're adapting those navigation models, financial toxicity boards in cardiovascular disease, neurosciences, all the conditions that are important to our Americans. So we're just very grateful for your focus.
Thank you. Thanks.
Wonderful. Well, we're just so thrilled to have had you here. Any final questions that you have for our wonderful team?
I think they covered it, don't you? I think our questions are answered, and I think we feel so much better about where we're going and what we're trying to achieve in the future. And you're leading us, so thank you so much.
We are excited to work in partnership with yourself, with our fellow centers across the NCI. Defeating cancer is a team sport, and we're just excited to be a member of that team.
Well,
Dr.
thanks.
Mesa, why don't we do a group photo?
Excellent.
Oh,
Great.
sure.
Perfect.